Hi, my name's Dr. Brian Gruber and I'm the founder of Integrated Orthopedics. Today we're going to be talking about fracture care, conservative and surgical management. So a fracture is an irregularity in the bone. It's usually secondary to a traumatic episode. Well, we see a lot of fractures in the kiddos, and that's really monkey bars, trampolines, things of that nature. So that's kind of a high risk by kind of what they're doing. Then you go into the more mature age group, and with people that are sort of more extreme sports, motocross, MMA, rugby, football, etc. With high energy, we see a lot of fractures in that age group. And then we go on to sort of the end of the spectrum with the more mature or elderly population, and we do take care of many fractures such as hip fractures, wrist fractures, and ankle fractures in that age group. We see many fractures. We're very comfortable treating all ages, so we'll see all the way from kids 5, 6 years old all the way to 95-year-olds. Well, with the fractures, each body part has a different classification, for example. So there's a classification for the wrist fracture, or a fracture of the knee or the shoulder. So oftentimes, when you determine every fracture, you typically would like to treat without surgery. However, there are times where if the fracture is displaced, meaning the two ends are not very close together anymore, oftentimes, in different areas of the body, those are going to require fixing those surgically. Oftentimes we'll treat fractures in a cast, and it really depends on the body part again. So if you break your ankle and it's non-operative, we may treat that in a boot. Same thing with the wrist, where you may get a cast, you may get a removable one that you can take off that will also protect. So and if you break your shoulder, you may just get a sling, because there's really no casting that's available for the shoulder, for example. So it can take the fracture treated conservatively, but it really depends on the body part to how it's going to be appropriately treated. And it also depends, the severity, for example, is how aggressive can you be with motion, weight bearing. So those are all things that each fracture, I like to say, kind of has its own personality. So you really have to treat that. So that you may line up 10 people that have a fracture of the ankle, and they all may get a little bit different treatment. So typically the bones will heal in about 6 weeks. So we always follow fractures early. So if a fracture is going to move, it will typically, when I say move, it shift. So it will shift early because the bones haven't quite become sticky yet. So we'll follow those within the first couple weeks. We'll see patients twice. So we'll see them, at the first week and at the second week, and then we can sort of lengthen out the visits after that. Typically, when the fracture is seen at about 6 weeks, we make sure we always take x-rays when we look for the fracture line. So the fracture line starts to erase as time goes on. So we'll watch that. We'll watch the x-ray, and typically at about 6 weeks, we will advance, weight bearing or strengthening, for example. And typically about 3 months, again, depending on the fracture, patients are pretty close to being done. Well, we talk about displacement or comminution, and there's a couple things where, and I'll just use the wrist for example. Some fractures, the wrist is completely, it looks normal, but it just has a line through it. So we call that a non-displaced fracture. And that's typically always treated conservatively with very good success. As the fracture begins to shift, then there becomes the question of should it be fixed? And that comes with really the age group. So, if you've got an 18-year-old, you're a bit more aggressive to make sure that fracture becomes relatively anatomic. And, if grandma or grandpa are in, a skilled nursing facility and it's their non-dominant extremity and nobody wants the risk of an operation, you could take the same fracture and you would treat that without surgery very successfully. So it really just depends on not only the body part, but the age and then the displacement. In general, fracture surgery entails, first off, you have to line the bones up. So, you get appropriate exposure, and then you take the bones, and really it's kind of like a puzzle. So you're going to put the pieces back together, So once the pieces are together, then you have to figure out how to hold them together. And it could either be plates and screws, a rod, just different techniques that you might employ. But in general, that's the basics of fracture work, or getting the bone lined up and then holding it there, oftentimes with plates and screws. Surgeries can really vary. Some very, traumatologists may do some very complex pelvic fractures that can take, hours, and you can versus you can take a wrist to the operating room and reduce it and pin it in 10 minutes. So it's a wide range. Now, physical therapy is very common with fractures of the upper or lower extremity, because oftentimes in general you lose a little bit of motion initially. So if you break your wrist or your ankle and you're immobilized, you're either in a cast or a boot, and you come out of that, your wrist or ankle, for example, will be stiff. So those oftentimes can require a little bit of physical therapy to work on your range of motion. Also, if you want to call it the collateral damage, where you're not walking on your legs, so the muscles become a little bit weaker. So that's also something that patients can benefit from physical therapy. It's important to get an accurate diagnosis quickly. And even if it's a non-surgical situation, which most are, it will give patients the sort of the time frame reference, if you will, where if it's just a bruise, it should get better within, or a contusion, better within maybe 2 or 3 weeks. But it's a fracture, it's going to take much longer, maybe 6 to 8. So it gives patients a better idea of kind of what they're up against, if you will, if they know that something's fractured.